Good afternoon, Miss. I am Orson Vine M. Caban from BSN2 Weidenbach, and today I am going to perform eye installation. So what is eye installation? Eye installation is the administration of the medication to the eye. Objectives: to directly apply medications into the eye, to provide means for eye evaluation, and to obtain desired therapeutic effect. Step 1. Gather equipment. Check the medication order against the original physician's order according to agency policies. Clarify any inconsistencies. Check patient's chart for any allergies. This comparison helps to identify errors that may have occurred when the orders were transcribed. The physician's order is the legal record of medication orders for each agency. Step 2. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of a medication to be administered. Consider the appropriateness of a medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to patient's disorder, and this can also be used to educate the patient about the medication. Step 3. Perform hand hygiene to prevent the spread of microorganisms. Step 4. Place medication on a tray or move the medication cart outside the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Step 5. Transport patient's medication to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevents accidental or deliberate disarrangement of medications. Step 6. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures that the right patient receives the medication and helps to prevent errors.
Good afternoon, sir. Ako balik si Nurse Vine. Pwede ko malantaw yung mga identification band? Pwede mo ma-state yung name, sir?
Luigi Tigirano.
Sige, thank you, sir.
Step 7. Explain procedure to the client to gain cooperation and to allay anxiety.
Good afternoon, sir. Bali, ma-perform kasi mo sa buong eye installation. Bali, mapatulog lang ko. Eye drop sa iyong mata. Okay, sir?
Step 8. Offer tissue to patient. Solution and tears may spill from the eye during the procedure. Step 9. Cleanse the eyelids and eyelashes of any drainage with a washcloth, cotton balls, or gauze moistened with normal saline solution. Use each area of the cleaning surface once, moving from the inner toward the outer canthus. Debris can be carried into the eye when the conjunctival sac is exposed. Using each area of the gauze once and moving from the inner canthus to the outer canthus prevents carrying debris to the lacrimal ducts. Step 10. Tilt the patient's head back slightly if sitting or place the patient's head over a pillow if lying down. The head may be turned slightly to the affected side to prevent solution or tears from flowing toward the opposite eye. Tilting patient's head back slightly makes it easier to reach the conjunctival sac. This should be avoided if a patient has a cervical spine injury.
Sir, pwede mo ma-ansay mo ulo, sir? Thank you, sir.
Step 11. Remove cap from medication bottle, being careful to not touch the inner side of the cup. Touching the inner side of the cup may contaminate the bottle of medication. Step 12. Invert the monodrip that is commonly used to instill eye drops. Have patient look up and focus on something on the ceiling. By having the patient look up, the procedure is less dramatic and keeps the eye still. Step 13. Place thumb or two fingers near margin of lower eyelid immediately below eyelashes and exert pressure downward over bony prominence of cheek. Lower conjunctival sac is exposed as lower lid is pulled down. The eye drop should be placed in the conjunctival sac, not directly on the eyeball. Step 14. Hold dropper close to eye but avoid touching eyelids or lashes. Squeeze container and allow prescribed number of drops to fall in lower conjunctival sac. Touching the eye, eyelids, or lashes can contaminate the medication in the bottle, startle the patient, causing blinking or injure the eye. Do not allow medication to fall onto cornea. This may injure cornea or cause the patient to have an unpleasant sensation. Step 15. Release lower lid after eye drops are instilled. Ask patient to close eyes gently. This allows the medication to be distributed over the entire eye.
Sir, pwede ka katanga. Close eyes gently.
Step 16. Instruct the patient not to rub the affected eye. This prevents injury and irritation to the eye.
Sir, hindi ba lang pagkatuloy mo mata, sir, ha?
Step 17. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Step 18. Assist patient to comfortable position. This ensures the patient's comfort. Evaluation. Patient cooperates with instillation of eye medication. Desired therapeutic effect is obtained. Experiences no adverse effects, including allergy response, systemic effect, or injury.